So I don't think I really chose the specialty of trauma and critical care. I think it chose me. When I was a little kid, the Vietnam War was on TV. That was the first kind of televised war in history. And little kids grew up, we'd play Army. Guess who was the medic? And I ran around and I would pretend to pull bullets out of the other kids and they would go back. I then became a Boy Scout. Guess whose patrol always won the region and the citywide first aid contests? We always won it. Then I became an EMT, one of the youngest EMTs that they ever had at the time. I think I was 16 or 17, became an EMT. I was running on the ambulance service since 16. And during high school, I used to get called out of high school classes because we were in a bedroom community and I was the highest trained medical person in our community during the day because everybody worked outside and they would work in the city. So it's kind of gone like that. And when I went into medicine and surgery, every time I tried to do something different than trauma, critical care, it seemed just didn't work out as well. When people are really ill, you have a chance to, I guess, make a big difference in many ways. I mean, you may not, in fact, frequently, you don't save the patient. I mean, and oftentimes the patient never knows who we were. They were unconscious when they came here, and they didn't make it. They didn't survive. But you can help out the families. You can impact their lives. You can give them comfort. It takes a lot more time. It takes a lot more empathy. But I personally find that rewarding. I feel that I can do something even in the worst times. The other thing that is, I mean, there's no other profession, and I know you'll hear this from every single doc you talk to, how great their profession is and how different it is than everybody else. So I think there's nobody that has the highest highs and the lowest lows. But the highs are great. So I'm board certified in general surgery with something called a Certificate of Added Qualifications in Surgical Critical Care. The American Board of Surgery feels very firmly that trauma is a part of general surgery. So they are not going to give a certification in trauma. They just felt that that's too much of a core of what it means to be a general surgeon, is to provide basic trauma care. But they recognize the difference between basic surgical care and intensive care or critical care units.